Welcome back to Eye on New York. The Food and Drug Administration has just approved a new treatment for spider veins. CBS 2's Dr. Holly Phillips reports on this new technique that makes unsightly purple veins vanish in an instant.
Not very pretty.
37-year-old Maria Shanuk feels embarrassed by the spider veins on her legs. Shanuk has her own ideas on how they turned up.
Being in the military for 8 years and being on my feet and also having 4 children, having 4 C-sections.
It's a younger patient population that we see with these problems. They're still young, they're very active, and they want their legs to look good.
Dermatologist Marta Rendon says the veins are more common in women than men, and patients are always looking for ways to get rid of them.
Remember, these blood vessels are caused by pregnancy, by obesity, genetics, aging, people that have professions where they're on their feet all day long.
Now there's a new way to erase the smallest spider veins. It's a substance called asclera that's injected directly into the veins.
Once you inject the substance into the blood vessel, it immediately disappears, temporarily of course, and then eventually with time the vessel will close and it'll get reabsorbed and it's just changed into other tissues.
Asclera has been used in Europe for some time, but just this year was approved by the Food and Drug Administration for use in the United States.
It's been 60 years before the FDA approved a new sclerosing agent, so we're very excited to have something that we know that works well, works fast, and has a very high degree of patient satisfaction.
Shanuk is one of those women who is completely satisfied with the results.
I think it looks awesome. They're not as predominant.
In clinical trials, both in the U.S. and Europe, 95% of patients who tried asclera were satisfied. But there can be some side effects, including bruising, irritation, and pain at the injection site. Dr. Holly Phillips for CBS 2 News.
Prices vary, but one 20-minute session costs around $500, and there are other options and ways to prevent spider veins, too. Dr. Navarro from the Vein Treatment Center is here now to talk about them. Doctor, thank you for coming in.
Pleasure. Thank you very much.
Now, I know pregnancy is a common cause of spider veins. What else can cause them?
The most important factor is a congenital predisposition. They tend to run in families. And then if you have this predisposition, pregnancies, female hormones, standing on your feet all day long, obesity, lack of exercise are factors that accelerate the appearance of veins.
So I saw in the piece there that it looks like a very tiny needle is used to inject this substance into the vein. Is that correct?
Absolutely. We use magnifying glass, special light, and here you can see it's a needle that's a little bit
very tiny.
Yeah, a little bit larger than a hair, or a couple of hairs. We do under magnification. We inject a little bit of this sclerosing agent, which is can be polydecanol, sclera, or it can be other solutions like glycerin, special sugars, sometimes a little bit of salt.
So it's not really painful. It's basically just a needle prick.
But you really do not feel it. And if the patient is very sensitive, we can prescribe a cream to put 1 hour before to numb.
Kind of a numbing cream,
exactly.
Right? All right, a couple questions. Is there a danger of any clotting when you're dealing with the veins this way?
No, that's very superficial, and so it doesn't. Sometimes the blood may clot inside the little spider vein, forming a clot inside the vein, a black and blue inside the vein.
But the idea is to close off the vein so that it eventually gets reabsorbed into the body.
Absolutely. If that happens when we see the patient the next time, we just prick the little black and blue from the vein. We squeeze it.
Well, let's see. Let's take a look at a before and after and see the results there. See, that's just astounding. Somebody that's a life-changing process.
Absolutely, it's dramatic. That's why it's such a happy practice, because people are usually healthy, but they are very
self-conscious
about self-conscious and upset about the presence.
Yeah. Any concerns about circulation when you're closing off veins like that? Does that create a concern that you're not getting the kind of circulation you need in the body?
No, these veins do not work. That's why you develop the spider veins or the varicose veins. Most varicose veins, which are the big tortuous veins, are accompanied by little spider veins.
Now, I know that the treatment for varicose veins used to be making incisions and pulling the vein out. That's not done anymore?
No. About 10 years ago, we developed in my office a new procedure called intravenous laser ablation. Which
using lasers?
Yes. It's used all over the world. We just changed the treatment of varicose veins, which is called phlebology. Now it's a specialty, in which we pass a very thin laser fiber inside the vein, and with laser energy, we seal the vein. Then start under strictly local anesthesia. Takes about 35 minutes. Patient comes in, we do the procedure, patient goes back to work.
that has, that little tiny line there has laser coming through it.
You connect this end to a laser machine, and when you connect the laser, it will lights up, and it releases the laser energy. And with that, we avoid going to the hospital. We avoid a surgeon, an operating room, and an anesthetic. Usually people used to have general anesthesia and stay in the hospital 2 or 3 days. So all that's avoided is now is a surgical procedure. It's a procedure, it's not a surgical procedure, done in the office, half an hour, back to work.
Is there, quickly, is there anyone who should not seek this kind of treatment?
No, anybody who has big varicose veins should be seen by a phlebologist. And then if you've been told that you needed surgery, the surgery, I have a surgical case in 10 years, and I have done thousands upon the, on
That's marvelous.
procedures.
I know, we all know people who have had that kind of thing, problem. Dr. Luis Navarro, thank you so much for coming. Very, very exciting new treatments.